Hey, it's Jessica Namaso with WTF Health. I'm here with Jenny Schneider, the president of Livongo. Jenny, it's great to have you with us.
It's great to be back, Jessica. Nice to see you again.
So I want to talk to you a little bit about applied health signals. So you guys launched this category and then you went public as the first ever applied health signals category to go public. But I want to deep dive into what exactly this is. And I want to talk to you about it because you literally wrote the book about this. So your book, Decoding Health Signals, was released earlier this year, right?
Yep, some point in early spring.
Some point in early spring. And so I want to just hear from your perspective, what is the category? What does applied health signals mean? Let's educate the industry on this. And then I want to find out too, a little bit more about some of the companies that may not realize that they are an applied health signals company. So how do you know if you are one? So let's start first though with the book and the definition of applied health signals. What does this mean?
Yeah, so part of the reason for us to give a name to what we're doing is because what we've been doing is something very different in healthcare, right? And so we've been able to, our vision has always been to empower people with chronic conditions to live better and healthier lives. But the way in which we've been able to do that is to really, truly, deeply personalize what we're delivering to our members and meeting them where they are. And so applied health signals as a category is an articulation of the technologies and capabilities that sit at this intersection of data science, clinical impact, and behavioral outcomes. And so it's really that combination. So the platform that drives this is a platform that we call AIAI, and it's intentionally a little bit of a pun on AI, right? So those four pillars, the first A is for aggregate. And this is where in the ecosystem from our cellular connected devices, medical claims, pharmacy claims, social determinants of health, members' preferences, continuous glucose monitoring data. We're aggregating data in the ecosystem that's useful for us to drive those outcomes. We then move that into the interpret, and this is where literally the behavioral economists sit next to the data scientists, sit next to the clinicians, and it's through that lens of all combinations. What's the data? What's the action? What words do we use to motivate that person? And how do we deliver that message? And that's that second A where it's apply. And so we apply those messages directly back to our members and meet them where they are. So we're not asking someone to do something out of their swim lane. We're saying, what do you use today? We can apply those messages back through our two-way cellular connected devices. We can apply those messages. I did a talk earlier on Alexa, HIPAA secure environment through Alexa, through cell phones, through text, through coaching. We just announced a partnership with telehealth providers. We can apply those messages directly to the telehealth providers. And then that last I is on iterate. And this is as we grow the ecosystem, grow our membership, and continue to take in and ingest more data in the ecosystem, we're getting smarter. So every day, that platform, that AI platform that we've built is running experiments. So we could say, the likes of you versus me, what do we respond to? The same clinical setting, the same clinical message. We respond to different words in different manners. And so we're capturing that data and getting better and smarter. And that engine, that experience is what's driving our three most important outcomes. First is our members loving us, elevated net promoter scores. The second is clinical outcomes that have been sustained for 3 years. And the third is cost savings for our employer clients.
Okay, so going back though to this idea of applied health signals, so this is a category, and I think what's cool about it as you explain the AI platform is I'm thinking to myself, this sounds more like a tech company than it does even a healthcare company, because tech companies kind of operate this way. It's like, if you're searching for something on Amazon, it's meeting you where you are with recommendations about other things that you might be interested in. So for those other healthcare companies that might be out there that have something similar to you guys, where it's not exactly a digital therapeutic and it's not exactly a digital health app, it's more than that. You're applying some real hard behavioral science to it, you're applying data science to it. What's the criteria for an applied health signals company that might fit into the category?
Yes, I'm going to maybe take a step higher first, which is you're exactly right. It is this intersection of technology and healthcare. So if you think about what Amazon did, they created, they did this new category within consumer. Facebook did this for community. Google did this for content, and we're doing this for care. So it is truly taking those technologies and capabilities and applying them to healthcare. And it's the definition of what that is, and are other people doing it? We do believe that there are other people who are on this journey. And it is, again, leveraging those capabilities around the data science, the clinical outcomes, and meeting people where they are in terms of driving those behavioral change. And so we welcome more people to join us on our journey, to take a page out of what we're doing, because we've been able to do this very effectively. And really, it's this consumer-first approach that we've been able to embed in this setting of technology that's really applied health signals. It's not digital health, it's not a little bit of AI and some sort of coaching. It's really a brand new, fundamental platform on which we're driving all of our messages, all of our behavioral changes and nudges.
And I mean, I know you guys get great feedback on all sides around you, from clinicians that are working with you, and especially from your members. But I wanted to ask too, I mean, I guess from your own, like from the Livongo perspective, you guys have been at this now for a while, and you're growing and you're scaling. You had the IPO earlier this year too. I mean, so what have you guys learned? I mean, as a result of doing this, because that last I is iterative, right? So I mean, what have you guys learned, and how have you adjusted to make sure that your solution is continuing to get the kind of, great response that it has so far?
Yeah, so the first learning, I think, is that through the IPO process, it was very clear that the market is ready. Like, the market understood what we wanted, what we needed. Our 720 clients, our outcomes that we've been able to document show that the market is ready for this. I think the second is that our most fundamental belief is that we must keep our member, we call them member, or the person with a chronic condition must love the platform, not like it, but love it, right? And so we talk a lot about and spend most of our time around designing that member experience. Because at the end of the day, you as a person don't really care what technology or what algorithms we're driving that experience. You care about the experience. And so we're using all that technology and algorithms and data science and truly putting it behind the scenes to give you a very novel experience that puts you as the healthcare person, the member with a chronic condition, in the driver's seat, and then working into the healthcare ecosystem from there. But flipping that on its head. This is not a provider-centric tool where docs are then going to use this and tell you what to do. This is empower people so they can do exactly what they want to do and live their life on the go, hence the name Livongo.
That was so cute. Like, I don't even know what to say right now. Okay, but no, I do know what to say. I was thinking to myself as you were talking, you had mentioned the clinical side of things, and you were the chief medical officer, and now you're the president, and you have a new chief medical officer. But I wanted to ask about the clinical side of things, because I know you guys have spent a lot of time going through some clinical validation processes, and this was something that a lot of people talked about actually when you went through the S1 phase and they were pricing for the IPO. So what, I guess, is on deck next for clinical validation? Can you give us any insight on what you're looking at next in terms of doing some studies to kind of, prove the fact that this AI machine is working the way that it should be?
Yeah, it's a really great question. So we are based in clinical foundation. We're highly clinically based. We have 13 published academic studies. We have 22 abstracts that have been submitted and accepted at various conferences. So we are absolutely grounded in clinical. We follow American Diabetes Association. We're partnered with the American Heart Association. We follow the clinical guidelines for the diabetes components. And so that is core to what we do, absolutely. We started to recently, and I just saw 2 days ago from my team of data scientists, some really interesting behavioral change data. What we've been able to show, and actually shared in the S1, is that 40% of the time when we make a recommendation for somebody to check their blood glucose again in the morning, 40% of the time people actually do that. That's astounding in chronic condition management. And we're starting to see the tail to understand how long that persists for. We have a number of other nudges that we've been able to see and document drive the behavioral change. So stay tuned. The team has submitted a bunch of new abstracts and new papers. So again, using the expertise we have in-house with academic rigor to demonstrate that what we're doing is highly impactful and highly effective.
No, and I think that that's going to be something that continually gets looked at is, what's the clinical validation, especially as this whole category of digital health, health tech, and applied health signals just matures. So Jenny, thank you so much for joining us. It's always a pleasure to speak with you.
As always, really fun to get to see you. Thank you, Jessica.
Thank you. I'm Jessica Damaso with WTF Health. Thanks for joining us.